Hey, you guys, I'm back. I'm going to try podcast podcasting again. The last video that I put out didn't get any views, and I'm like, I don't think I uploaded it properly. So I know it's been a year since I have done this or have quote podcasted, and I was going through the different criteria for BPD. And I think I was on number 6, which is because there's 9 criteria for BPD, which is number 6 is affective instability. And basically, what it says is that due to marked reactivity of mood, leading to intense episodes of dysphoria, irritability, or anxiety lasting a few hours to a few days. Well, yeah. Now that I have become, a full-fledged therapist, I'm working in a practice, and I mean, I've told people that I work with who come down on borders, people, and I'm not knocking people with substance issues. I work in the substance space myself. Um, but when people who are therapists or who are, they're like, yeah, I'm recovering. I'm a recovering addict. My last date of use was, 12 weeks ago or 11 weeks ago or 11 years ago, or I go to a meeting. I've been going to a meeting every day since 19 whatever. And everybody gives them this golf clap. They're like, oh my gosh, that's so awesome. But yet, if you say, yeah, well, I'm a recovering boarder, people kind of give you that there's that uncomfortable silence, or there's a silence. I won't read into it. I won't. But people don't know what to do. And also, I find that when you are, you know, sometimes I feel like maybe I shouldn't have said anything. Maybe I shouldn't have said that I'm a recovering boarder. Maybe, because people, all they know is what it's like to deal with a boarder when they aren't one themselves. And so when you say, I'm a recovering boarder, to somebody who deals or who performs therapy or has patients as borderlines, they're only used to seeing the shitty side. They're only used to seeing this shitty side of us. Um, and I feel that I've got to realize that, when I say that, I'm a borderline or whatever, people are just used to, you know, one one idea of us. And so for the provider that's listening, um, it's I can say to you that your your patient who's a boarder is, it's not like, oh, are you telling the truth? Are you just saying that to, you know, make me feel bad, or are you trying to, you know, boarders are probably one of the most truthful people that you'll meet because they are so blunt and so, like, they, I mean, we don't give a fuck sometimes. Like, we're just, this is how we have learned to survive. And we have, this is how we've learned to deal. And so if your boarder is your patient is, going off on you or is ranting to you about something, you know, and you find yourself going, God, you exhaust me. Just remember that you're only seeing one part of them. You have no idea how exhausting it is to be a boarder. And I I tell young boarders, who are in their 20s, who and I'm like, listen, you'd rather be dealing with this right now, sorting this stuff out now than doing it at 57. That's my age, you know. Um, I've worked with a therapist, a regular therapist. This guy, he and I have gone toe to toe for like the last 12 years. But he has been a source of, um, let's see, how should I put it? Like consistency. He is consistent in what he does. And when I notice that he's not being consistent, like if he's like takes like, well, okay, well, let's talk about this topic next week, and then the week after, he's like, if something's come up, he's like, well, let's talk about it. And I get it, but I'm like, dude, I need to stick to one topic. We need to like, if we're going to talk about my PTSD, we're going to talk about it until it's fixed or subsided or I know how to deal with it or something. But I had to be like, dude, I know you used to get on to me about me switching my medications up all the time because if a medication didn't work, I'm like, oh, we need to switch it. We need to. And finally, he said, okay, you switch your medications too much. We can't do that. So so basically, what I'm trying to say is that consistency is the best. It's the most productive thing you can do for your patients. And what if, and you boarders out there, you know, that's the best thing to have because what did we grow up with? We grew up with no consistency. When I thought I was going to be punished, people laughed. And when I didn't think I was going to be punished, when I didn't think I was going to be punished, I got hammered. And when you grow up on shifting sand and your foundation sucks and it's constant and the target is always moving, we like, even though we're like, I don't know how to explain it, but we deep down we want consistency. And with the effective instability is that when we get triggered, we just we I feel, and I'm going to talk, is sometimes we need to be that chameleon, um, or when we have that instability where we're too happy or we're irritable or we're in a shit mood. Sometimes I think, is it because we're trying to fix something in the past? Is it we're triggered by something that happened in the past and all we know is how we reacted to it in the past? Are we trying to fix something? Um, or or I don't know. It just kind of came to me. But our moodiness, our affect instability is it our need to grasp on to a stable thought or a stable person or a stable, we fly off the handle because it's not because we don't get what we want. It's because we, I don't know, like, it's not because we don't get what we want. it's because are we searching? Are we searching for that stability? And we just feel like we have to go through all these different um, moods. Our affect has, not has to be changed, but maybe we're moving through all the different affects to find one to present to that trigger. It's kind of like flipping through clothing on a clothing rack. You're like, okay, no, 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 that sucks, that sucks, that sucks. And then all of a sudden find something that's like the right color, it fits, and you're like, thank God. Is that what it is? Or are we going through the instability of being irritable or moody or having anxiety because we're punishing ourselves with that affect? You know, are we punishing ourselves because you know we're we're feeling, somebody says, hey, you don't look as depressed as you used to, or and you're like, well, I don't want, don't say that because I'm still depressed. Don't make me look better than I am, or don't make me feel, just because I'm smiling doesn't mean I'm not depressed. And sometimes I think people, borderlines, are, we're, like, we're like, don't, you know, yes, I'm smiling, but I promise you, I'm about to eat your face off. But I tell me what you think, because I'm kind of at a quandary in the sense of, and I don't want to put the thing on pause, but I'm just, do we do we react to other people's reactions to either punish ourselves or to be stubborn against what somebody says, and we really don't want them to know that who we really are. I don't know. I'm just throwing the proverbial spaghetti against the wall type thing. Um and maybe, ask your therapist, ask, who do you think, or ask your best friend that's known you for a really long time. I have a best friend that I've known since I was 14 years old. And even though we haven't like lived in the same state for a really long time, we talk to each other maybe once or twice a month, but we can always get back to the things that are important to us. And I can ask her, like, how do I deal with this? You know, how do I deal with being in a private practice? And she's a CEO of a company. And because sometimes I'm like, do I really, what am I doing? Type thing. And, but so, all right, I'm going to put it on pause for a second. I gotta collect my thoughts.